Hello, welcome Komal.
Good afternoon, sir.
Good afternoon. After so long time you are attending the live classes.
Yes, sir.
Okay. Now we should continue with the. Have you followed the previous recordings?
Yes, sir.
We have moved to Robert's philosophy for understanding of chronic diseases. Okay. We
Yes, sir.
are in chapter number 23. We will read today chapter number 23 from Robert's philosophy. Disease classification, Psora. Okay.
Okay, sir.
In previous classes, I have told you that to understand. Okay, please put on your headphone. Otherwise, my voice will be echoing. You
Okay, sir.
can please put on your headphone. If you are wearing your headphone, it will be not echoing anymore. Otherwise, my voice will be constantly echoing. Okay. Uh, so in the previous classes, I have told you that this is the Robert's chronic diseases is the basic thing you need to read first in order to understand the concept of chronic diseases. It is a must book for the beginners to go through regarding the classification of disease and the miasms, Psora, syphilis, and psychosis. This is so much important both for clinical as well as academical purpose. Okay, in academy you will get the questions in your MCQ. Any of the MCQ question, any of the MCQ examination, look at the question. If you are getting a question on chronic miasm, this is most probably from Robert's these chapters. Okay, so these are important for your academic purpose also and important for your clinical purpose also. Okay, to understand, this is the basic book to understand chronic miasm. If I would have designed a course for understanding or just reading chronic miasm, the first book I would have referred is Robert's Chronic Diseases, then J.H. Allen's, then Chronic Miasm by Dr. Hahnemann. Okay, these are the steps of understanding chronic diseases. So we have started already Robert's classification of diseases, and we are in the chapter number 23, Psora. Okay, the first paragraph. Can you read for us, please?
Okay, sir. Soda has numerous sensations of vertigo. These are of many kinds and accompanying all the kinds of motion and are often induced and or aggravated by emotional disturbance. Hahnemann speaks
Okay,
of
stop here. Induced and aggravated by emotional disturbances. Underline this. Numerous sensation of vertigo. Underline this. Accompanying all kinds of motion. Underline this. Okay. This induced or aggravated. My voice is echoing. Are you not using this headphone, Komal?
I'm using headphones, sir.
Okay. I don't know why my voice is echoing. It is less echoing now, but it is echoing. Okay. This aggravated by any of the emotional disturbances. I cannot concentrate. My voice is echoing. If you can put off your mic. My voice, I am listening it back, so I cannot concentrate on this. Uh, it will be very difficult to conduct this class. Now, accompanying this aggravated by any emotional disturbance, this is the virtue of Psora, that it is aggravated by any of the emotional disturbance. Hahnemann says in chronic diseases that Psora is mostly aggravated by emotional disturbances than any other miasm. Okay, syphilis is not that much aggravated by emotional disturbance, but this Psora is aggravated mostly by emotional disturbance, failed marriage, okay, failed affair. These are the grief which this psoric people purely, where this Psora is predominance, these psoric people will not endure this. I have told you before that after marriage, if a girl is started to having problems, you have to look two things. Okay, whether there is marriage mismatch in marriage. If there is a mismatch in marriage, and the lady is suffering from the grief, or the boy is suffering from the grief, it is happening both way nowadays, and more you can say it is happening in equal proportion in the both the gender. Previously it was mainly in the females. If the female started to have lots of problem after marriage, you have to look out the two things. Either the marriage was mismatched, or the other spouse, the other partner was affected with psychosis or gonorrhea, and that had been transformed in that stage to the other wife or husband. Okay, so if the marriage was not mismatched and the people are happy with each other, even the health is deteriorating, think of psychosis and syphilis. And if the marriage was mismatched, think of Psora, predominance of Psora. Okay, so underline induced or aggravated by emotional disturbances. Numerous sensation. We have read in the last chapter the Sora has with many symptoms of subjective symptoms. Sora is the producer of almost all the subjective symptoms. So vertigo is one kind of subjective symptoms, and Sora is having it in imminence degree. Okay. Now please read next.
Animal speaks of the vertigo of Psora as being many and peculiar, brought on by walking motion, looking up quickly, rising from sitting or laying, bilious vertigo, floating sound, digestive disturbance, with tracks, tracks before the eye, desire to keep quiet by laying down, which which
Ameliorate.
ameliorates um, in this desire to lie down and emulate by laying down, they have the outstanding characteristics of the whole underlying condition. There
Okay, now
are
put your mic on. Put your mic on, and I will discuss this. Okay, underline this. In this desire to lie down, underline this. In this desire to lie down, and ameliorated by lying down, we have the outstanding characteristics of the whole underlying condition. Underline this. Any, if you have been asked any of the symptom, suppose you have been asked symptoms of headache of Psora, okay, symptom of heart of Psora, symptom of abdomen of Psora, any symptoms which can have modality. Obviously hair fall cannot have modality of lying down, that hair fall is ameliorated by lying down, but any of the complaint which have can have the modality of by amelioration by lying down, be sure that you can use this modality in any of the complaint of Psora, that amelioration by lying down and desire to lie down. You know that sulfur patient, the most aggravated posture for the sulfur patient is aggravation by standing. Okay, cannot stand too long. Sulfur patient, if you have Alice cannot, you can check out there that cannot endure to stand too long. Okay, so sulfur is actually the king of Psora, and it has many symptoms of Psora in eminence degree. So vertigo, amelioration by lying down. Vertigo, amelioration by lie down. Headache, amelioration by lying down. Body ache, amelioration by lying down. With specks before the eyes, the black dot. If it is functional black dot, okay, where you will get black dot in the eyes, you will get in retinal detachment, some retinal diseases, you will get constantly uh, black dots in uh, before the in the vision. Okay, this is, if it is functional, it is of Psora. If it is due to retinal damage of the retina, then it is syphilis or psychosis, most probably syphilis, because we have discussed that syphilis has the sphere of action on the eye. I hope you remember that we have discussed before the sphere of actions of different miasm, and syphilis was most prominently affecting the eyes, the palates, okay, the larynx and trachea, the bones, and its osteo this epiphysis of the bone is the sphere of affection of the syphilis. So if it is constant, so you mean it is not pathological. If it is constant, patient is complaining that a black dot before the eyes is constant. It is not moving here and there and not moving anyways. Whenever I am seeing, it is constantly present there. This indicates a pathological change in the retina and indicates the syphilis predominant. But if it is not prominent, okay, if it is coming and going, if it is coming and sometime is there, sometime it is not, it is functional one, and think of Psora in the background. Okay, so with the specs before the eyes, flickering of the vision, cyclamen in Allen's keynote, you will check out that cyclamen have a symptom, flickering of this flickering of things before the eyes. Okay, these are the functional symptoms, but in aurum med you will get only half of the vision is present, half lost. This indicates the some pathology in the brain, some pathology near the optic chiasma. Okay, so these are, you have to differentiate with this pathological. Psora alone cannot go up to that pathological state. If it is due to Psora, it will be functional and it will be restored in within some time. If it is not restoring, think of any other miasm which is predominance. Okay, mostly syphilis. Now go on to headache. These are the symptoms of headache. Vertigo may be there due to digestive disturbance. Okay, if the vertigo is there due to digestive disturbance, it is of Psora. We will read the vertigo of syphilis later on. The vertigo of syphilis starts from the base of the brain. The patient will tell that I am feeling that this vertigo is coming from here. Headache, the affection, the site of action for the headache of syphilis is the base of the brain. Here, headache is here. Okay, but for Psora, headache will be here. Clear? Now, read the next chapter. Next paragraph.
Sharp, severe proximal headache, which comes on in the morning, increase as the sun rises, and ameliorate when the sun goes down. These are usually frontal, temporal, and parietal. The headache with red face, throbbing, ameliorate by rest, quiet, and sleep, and ameliorate by hot application at coding.
Okay, stop. You get the character of headache: sharp, severe, paroxysmal headache, aggravation, modality. Okay, what a symptom consists? Complete symptom consists of the sensation, concomitant sensation, location, modalities. Okay, and later on concomitant. So here the sensation is there, throbbing pain. Okay, the headache with red face. Red face is concomitant, you can include that concomitant. Throbbing, modality is there, amelioration, aggravation by increase of sunrise. Okay, Psora headache, your Psora, any symptom of the Psora is aggravated in morning, and any symptom of psychosis is aggravated, syphilis is aggravated at night. Okay, psychosis is evening or night, like that, but syphilis has marked aggravation in night. It is being called that it is increased with the rhythm of the night. जैसे जैसे रात बढ़ती है, सिफिलिस का हर कंप्लेन बढ़ता है. ओके, जैसे जैसे रात जाती है, open your Allen's keynote and read the modality of syphilinum. You will get that it is increasing with the night, and जैसे जैसे रात फिर ढलना शुरू होती है, increase करता है, it is at the peak when the night is at peak, and जैसे जैसे रात फिर ढलना शुरू हुई, सिफिलिनम का और सिफिलिस का कंप्लेन कम होना शुरू हुआ. This is the rhythm of the night. Same way for the Psora with the sunrise. जैसे जैसे सूरज उगता है, Psora का हर कंप्लेन बढ़ेगा. At the peak, the complaint is at the peak. Then कम होना शुरू होगा. Amelioration with the sunset. That is why the syphilinum is being called, syphilis is being called the worshipper of sun. Okay, or Psora is not worshipping the sun, because This is not ameliorated by the sunrise. It is aggravated by the sunrise and ameliorated with the sun is getting down. And syphilis has exactly opposite modality. Okay? The increase of the sunrise ameliorate when sun goes down. Okay? Underline this. This is the modality you can use everywhere. This is the modality you can use in any complaint of Psora. So you need to remember this. Okay? You need to remember this. Now I want you to go to chapter number 26. Okay? We will compare the headache of syphilis with the headache of Psora. Okay, go to page number 211. I don't know what page of yours it is. I'm telling the paragraph number. Better to give the number to paragraph. Okay, so it will be easier for us to refer. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. 11th. Paragraph 11. They are always worse at night. Syphilitic stigma. They are always worse at night. I hope you got that.
Yes, sir.
Very good. So I'm just reading it quickly. Just underline. They are always who? The syphilitic. Worse at night. All the symptoms develop more after sun goes down. Okay. All the symptoms develop more after sun goes down. This is rhythm of the night. One of the more characteristic. You will see the syphilinum in Allen's keynote. This characteristic has been written in bold. Okay, just check it out. It is being written in bold. Okay, worse at night. All the symptoms developed after sun goes down. There is oppression, restlessness, anxiety at night. You remember the panic attack our patients were having during COVID pandemic. Okay, when the pandemic was at its peak. Okay, the panic attack the patients were having were usually at night. This indicates a syphilitic and psychotic base of the COVID. Mainly, we are telling that this COVID has a psychotic base, but in the patient who are a syphilitic base, they will call you at midnight, calling you for anxiety attack, restlessness. जैसे रात हुआ मेरा anxiety शुरू हो गया. This anxiety neurosis, if it is happening at night, okay, this indicates a syphilitic base. Anxiety at night. You check out any anti-syphilitic medicine. Mercurius, aggravation, night. Okay, asafoetida, aggravation, night. Auromet, aggravation, night. It is very easier to remember the modality if you know the mechanism behind that medicine. Okay, Auromet, we are using it as antisyphilitic medicine. Asafoetida, we are using as antisyphilitic medicine. Mercurius, king of antisyphilitic. Syphilinum, king of antisyphilitic, and it is one of the indication in your patient which will hint you to the medicine. That aggravation at night, you think that there must be a syphilitic predominance and I have to choose a medicine from anti-syphilitic group. Okay, so anxiety at night, they dread the night because it is so oppressive. They dread the night because it is so oppressive. Now go to 1, 2, 3, 4. Fifth paragraph of that. After that. Okay, fifth paragraph after that. The headache. The headache. Read that paragraph. Fifth paragraph of that. Yes, chapter number 26.
Now investigators in the ordinary school of medicine have begun to question whether a cycle is not
No,
a
no, chapter number
provision.
26. Leave it. I'm just you are not finding it. I will show you. I will show you. Okay. This is chapter 26. Okay. Disease classification. I am asking you to read this para. This para. Okay. It is page number 212 in my book. Just I am reading. Just listen to it. Okay. The headache that comes on Sunday or when they are away from their usual vocations are usually psoric and syphilitic combination. Syphilitic headaches are usually aggravation by riding, amelioration by motion, aggravation by exertion, either mental or physical. They are usually accompanied by great deal of coldness of body, sadness and prostration. They aggravated by warmth and heat. Psora headache was ameliorated by heat. Okay, by application of cold. Aggravation by quiet. Syphilitic headache. Aggravation by quiet rest. And you remember what we have read in Psora? Psoric headache was ameliorated by lying down. Is it not? But this syphilitic headache, aggravation by quiet rest, aggravation by lying down at night and by sleep, amelioration by nose bleed. Okay, any unnatural discharge. Remember this always. Any unnatural discharge will ameliorate syphilis and psychosis. Amelioration by nosebleed. Okay, now in the bracket, note the indication for syphilitic headache. We are actually reading chapter number 26. Those who are joining now, we are reading chapter number 26 from Roberts' Chronic Miasm. Chapter number 26, page number 212. We are differentiating the headache of Psora and headache of syphilis. Note the indication for syphilitic headache as being most exactly opposite those of psoric type, which is ameliorated by rest. Always remember, Psora headache or Psora, any of the complaint of Psora is ameliorated by lying down, ameliorated by being quiet, ameliorated by lying down, ameliorated by rest, ameliorated by hot application. Now you will ask that sulfur is a hot patient. Okay, and sulfur is aggravated by hot. So this is an exception. Sulfur, though sulfur is an anti-psoric medicine, king of Psora, still sulfur is aggravated by heat. But psorinum, you will get in psorinum, which is ameliorated by hot application, which chilly patient. Okay, sulfur, there is a difference between sulfur and Psora, which is their thermal reaction. Though sulfur is an anti-psoric medicine, king of anti-Psora, but it is aggravated by hot. But Psora is ameliorated by hot. Okay, and you will find this modality in psorinum. The psoric headache comes in daytime. What is written? Psoric headache comes in daytime, while syphilitic headache are manifest at night. Okay, manifest at night. And one more difference we have, that psoric headache mostly frontal or on side, but syphilitic headache are mostly at the base of brain. Okay, mostly at the base of brain. Okay, now just we are in page number 211. Okay, here I want you to look at this paragraph. Just below that, what we have read, the natural avenues of elimination do not ameliorate the patient. You remember the mercurius? You remember the mercurius? Where sweating is more open, Allen's keynote, profuse sweating. It is written there in the initials, profuse sweating, but sweating is aggravating. Psora is ameliorated by natural discharges, while this syphilis is aggravated. Sweating aggravate rather than ameliorate. Natural sweat, profuse urination, diarrhea never ameliorate the syphilitic condition. Okay, never ameliorate the syphilitic condition. Natural discharges will never ameliorate the syphilitic condition. Here, rather, it will aggravate. It will aggravate. And syphilitic headaches are ameliorated by nosebleed. Nosebleed is not natural. Okay, tell me a medicine where headache is ameliorated by nosebleed. Tell me a medicine where headache is ameliorated by nosebleed. I'm not getting my Allen's keynote here. Otherwise, I would have shown you the line. Tell me a medicine. Anyone? Open Melilotus. Melilotus in Allen's keynote. Have you Allen keynotes with you? Have you got your Allen's keynote with you? Just open it. Just open it. And read Melilotus.
Which part, sir? Whole.
Melilotus. Just the headache ameliorated by nosebleed. Got that? Headache portion. Headache portion.
Melilot.
In Allen's keynote.
Yeah, yes, sir. Violent congestive or nervous headaches, epistaxis affords relief.
Okay. What is epistaxis? Epistaxis is that?
Nosebleed, yeah.
The nosebleed, huh? And in bracket, you will what you are saying?
Bufo, ferrum phos, and magnum sulf.
Okay.
Yes.
This ferrum phos, you know the this iron, ferrum metallicum or iron groups. Okay. All are antisyphilitic. Go to ferrum mate. Go to ferrum mate. Got ferrum mate and read the syphilis line. Last, you will get it above the relation. You will get it above the relation. Read the line which is telling about syphilis. Got that line?
Should never be given, and syphilis always aggravates the condition.
Okay. In syphilis, if it is given, always aggravates the condition. Read the modality. Read the modality.
Aggravation at night, at rest, especially while sitting still. Amelioration, walking slowly about in summer.
What modality is indicating? What the modalities is indicating?
Aggravation at night.
And
Rest and while sitting still.
and syphilis modality. When it is given in, can you listen me? Am I audible? Am I audible? Okay. Whenever Alan is saying that syphilis, whenever it is giving in syphilis, always aggravate the condition. But in syphilis means the primary stage of syphilis, not the syphilitic taint. Okay. You see the thalassemia. Those who are thalassemic carrier, okay, are always aggravated by iron tablets, crude iron tablets, and this blood dyscrasia. Those who are anemic, the aplastic anemia, okay, always having less iron in the blood and aggravated by crude iron. This shows a strong syphilitic base The people who are aggravated by crude iron is showing that those people are having strong syphilitic base. Okay, you see the vomiting of vertigo of ferrum. Okay, it is always coming from the base of the brain. So this is indicating the syphilitic taint of the ferrum. Just we have deviated from our topic. I want you to learn the medicine from the aspect of miasm. Okay, you are seeing a certain modality in a medicine. From that you can catch up which miasm. Just you have seen the aggravation at night and aggravation by rest, which miasm this medicine can carry. Okay, and in your patient, when you are getting the symptoms and their modality, you can judge which miasm the patient is carrying prominently, and this will lead you an easier selection towards an easier selection of your medicine. Okay, so we have differentiated the headache of Psora and headache of syphilis. Headache of Psora is always functional, but headache of syphilis, be aware if your patient are complaining of headache and you can see that there is a syphilitic taint in that patient, be aware there might be, this might not be a simple migraine you are dealing with. Some pathology in the brain, some tumor in the brain, some tumor in the eyes, some pathology in the eyes. Okay, if he has having a syphilitic family history or syphilitic background. Clear? Now read, come to third paragraph of our 23rd chapter of Roberts. Third paragraph. Chapter number 23.
The bilious nausea and vomiting coming on at regular intervals, hemorrhage from rest, quiet, and sleep are soric.
Okay. Next.
The characteristic desire to lie down and be quiet is manifested in feverish children who desire only to be let alone.
Next.
Psoric manifestation may be a link in almost all disease conditions, and they are always emulated by heat. Soda alone
Okay, two
never
things.
causes.
Now, stop here. Two characteristics you are getting: ameliorated by heat and ameliorated by lying down. With every complaint you can add these two modalities, whether it is headache, whether it is body ache, whether it is anything, whether it is vertigo, any complaint, if it is carrying these kind of modality, it will always be ameliorated by lying down, it will always be ameliorated by heat, warmth, because Psora is chilly and sulfur is hot, that is exception. Okay, though sulfur is an antisoric medicine, this is a hot medicine, thermal reaction and aggravated by heat, that is an exception. But you know the characteristics of Psorinum, what is that? Extremely chilly, wearing the fur cap even in the summer. Okay, if you open your Allen's keynote Psorinum, you will get chilly patient wearing fur cap even in the summer. You will get repertory only single medicine wearing the fur cap, wearing the shawl, wearing the suitor. Extremely chilly patient is Psorinum. Okay, and we know that Psorinum is antisoric medicine. Sulfur, there is an exception to that. Now next, read next.
Soda alone never causes structural changes, and the psoric head is normal contrast. The hair is lusterless and do dry, does not be combed without wetting the comb. The hair fall out after
Tell me a medicine. Tell me a medicine where the hair cannot be combed.
Smith या borax.
Podium,
What? What? Which medicine?
lycopodium,
Lycopodium. And borax. Open borax from Allen's keynote. Open borax from Allen's keynote and read the hair
Yes,
is
sir.
constantly tangling. Okay, cannot be combed. Got that line?
Psoric acid, lycopodium, sorinum, tuberculinum.
In the bracket is there.
Yes, sir.
And the main drug is
Borax.
borax. Okay, clear? So this borax, this lustreless hair, even by seeing the hair of the patient, you can, if you are getting a silky hair, okay, this indicates a syphilitic plus, sorry, tubercular background. Silky. If it is lustreless, dry, not shiny, it indicates predominance of Psora. Predominance of Psora. Okay. It cannot be combed. If it is tangling, that indicates more psoric. And you know, the borax has having more subjective symptoms like afraid of being afraid of downward motion, easily frightened by slightest noise, easily frightened by the matchbox striking, okay, easily frightened by any of the noise. This is borax. Subjective symptoms are more sensitive to noises. We will read it that Psora is having oversensitive senses, oversensitive senses. Okay, just read next.
It becomes gray too early or white in spots. It
The hair falls after an illness. Underline this. You will get patients. I don't know whether I have told you this. You will get patient that complaining of hair fall mostly. Okay, if you get certain modalities of this hair fall, when this hair fall started, you will be easy. It will be easier to cure for you. Okay, it will be easier. Have you told that? Have I told you that after any acute disease there is a rubric hair fall? Do you remember that?
Sir, your voice is not clear, sir.
Okay. Let me rejoin.
It's okay now, sir.
Have I told you that there is a rubric in repertory after acute disease, hair fall out after acute disease? Do you remember that?
No, sir.
Okay. Underline this. The hair falls out after an illness. Hair falls out after an illness. Name a disease where hair falls out after completion of that disease. Name a disease commonly seen in practice.
Cancer.
But after that treatment, not cancer, that is
No.
the artificial treatment for that cancer, artificial
Chemotherapy.
disease.
Due to chemotherapy.
Chemotherapy. After that chemotherapy. Typhoid, most common illness after which hair started to fall out is typhoid. Okay, and we sometimes use typhoidinum for that. Okay, we are taking typhoid as acute miasm having a psoric base. Okay, and after typhoid, if the hair falls, we are commonly using typhoidinum. But this is indication of Psora. After any illness, we have told that there is some remnants after any illness, acute illness, whether it was individual acute, whether it was due to acute miasm. If this was due to acute miasms, we are taking typhoid as acute miasm. Okay, we are taking chickenpox, acute miasm. Any illness after that acute miasm, you will get lots of cases. Pimples started, acne started after chickenpox. We have malandrinum for that. Okay, these all are practical, you can say, tips. Okay, this don't utter this in front of your examiner as a wholesale manner. Okay, these are the practical things which we are using in our clinic for examination purpose. You will say that, sir, we have to go to complete case taking, do a totality and prescribe a medicine, and this nosode can help us as an intercurrent remedy. But for practical purpose, this is not for academic purpose. This is for clinical purpose. We are giving the nosode of that acute miasm. Any illness after that acute disease, we are trying our acute nosodes, acute miasms nosode. Okay. If the hair falls out after illness, you can think of sorinum, you can think of sulfur. Clear? Because it is one of the indication for Psora. Number one thing, if do you remember that appetite will not return? Which medicine having this symptom? Appetite will not return after illness. Name the medicine, name the drug. Those who are preparing for their MDs. Okay, these are the MCQ from Allen's only. Okay, this sorinum has got, after acute illness, appetite will not return. And in Calcutta School of Homeopathy, this is being practiced as a sure indication for sorinum. Okay, I have seen my teachers giving loss of appetite after acute disease, sorinum. Okay, and this is the indication given in Allen's keynote also. So the hair falls out after illness. After illness, if some disease, some remnants of that disease remaining, think of antisoric medicine. Firstly, think of the acute miasm, nosode of that acute miasm. Nextly, there is a indication in Pathak's repertory. If you have Pathak's repertory, go to hair affections, falling after fever, after acute disease, you will get fluoric acid as a single rubric there in Pathak's repertory. If in Pathak's repertory you are getting clinical rubric, you can swear by that rubric that this medicine will work. Acid flow. By the way, what is the miasm behind acid flow? What is the miasm behind acid flow? Can you tell me? Yes? What is the predominant miasm behind acid flow? Syphilitic. Why you are saying so? No, hair fall तो यहाँ पे हम लोग देखें तो soric हम लोग देख रहे हैं. This is we are seeing soric. So that is also exception. That acid flow is working in that kind of hair fall. That may be some soric element in that acid flow. But read the description of acid flow in Allen's keynote, and you will get
warmth. Aggravation from warmth.
Aggravation by warmth and sphere of action. The ulcers of bone, necrosis of bone. What is this? Necrosis of bone. Affection, sphere of affection of acid flow. Necrosis of bone. You will see the acid flow is predominantly an antisyphilitic medicine. But here in psoric condition also it is working. Okay, it is working. So you can take it as an exception. The rubric in Pathak is, I can swear by that rubric, even after any acute illness, if the hair is falling, you can surely prescribe with other indication may not be there. This is one of the indication for acid flow to prescribe, and the hair will stop falling. Okay, same thing. If you have Pathak repertory, go to that hair affection falling after grief. Okay, falling after grief, you will get a single. This is a clinical discussion out of the topic we are discussing. Out of that, just what I am seeing in my clinic, I am sharing with you that acid falls after grief, any hair fall after grief. Recently I have prescribed, not recently, 2-3 months before that, the girlfriend was cheating the boy and the boy started this hair fall. I asked, and it was not easy. That was obvious cause. From aphorism number 93, I think it is in 93, obvious cause. You have to ask the patient, framing the question, and like that you have to gain the confidence of the patient to ask such things. That so the boyfriend accepted that he was grieved by that behavior of the girlfriend, and after that I was having hair fall. I prescribed acid fall basing on this history, and with the psoric background, that patient was cured of his hair falling. Okay, so these rubric I wanted to share with you. their hair falls out after illness. What can you think of? So we have discussed that we can think of any antisoric medicine. We can think of the acute miasm for that, and nosode for that, acute miasms nosode for that, and next we can think of these rubrics, okay, in Pathak's repertory. Now next, read next.
The skin and the scalp appear unclean, and there is much itching, dandruff, and dry eruptions on the scalp, either papular or eczematous with itch. These eruptions are aggravate in open air, aggravate in evening,
Eruptions on the
ameliorate
scalp.
by
Okay, here का खत्म हो गया. यहाँ पे hair is ended. So here gray too early. Have you seen patient whose hair are graying too early? Okay, there are psoric patients. White spot, gray hair, some patches of gray. You remember that Vinod Mehra, I think, or Vinod Khanna was there with a white strip of hair. That was his hairstyle. Okay, white strip on the head. So graying too early. These are psoric manifestation. Next, eruptions aggravated in open air, aggravated evening. That is an exception. That is an exception for the Psora. Psora we have read that ameliorated, but this is aggravated. Ameliorated by scratching, burning and smarting follow. These eruptions do not suppurate. Underline this. These eruptions do not suppurate, but dry down and become dead scale. Okay, if you get what is the eruption of mesothelium? Open mesothelium and read the eruption from Allen's keynote. Dalkamara, mesothelium, cicuta, you will not get dry eruptions, but in sulfur you will get dry, scaly, just scratching, no fluid is there. If there is fluid, it indicates that Psora is not predominant. This skin eruptions, always remember, skin eruptions may be Psora, maybe syphilis, maybe psychosis, depending upon its characteristics. Secondary skin eruptions, okay? Primary skin eruption of Psora, we know that there is a scratching and some sticky fluid discharge may be there, like in scabies. We have read the primary manifestation of Psora, but after suppression, if these skin eruptions are coming secondarily, these are always dry, okay, for Psora. Now next, read next paragraph. Read next paragraph.
There are many eye symptoms, but since there are no structural changes under this uncomplicated stigma, we find no pathological changes. The symptoms all have to do with the functional relationships and are closely related to emotional disturbance.
Underline this: functional and related to emotional disturbances. Okay, every sense of Psora is oversensitive. Every sensation of Psora is oversensitive. They are oversensitive to eyes, they are oversensitive to smells, they are oversensitive to noise. Okay, they are oversensitive emotionally. Okay, every sense of Psora. What is there in Nux vomica? Every trifling word, every harmless word excites him. Okay, I don't know why I am exciting. There is he didn't have told me anything wrong, but still I am irritated. Every harmless word offended. This is the line in Nux vomica, and Nux vomica is predominantly a psoric medicine. Okay, oversensitiveness of senses, oversensitive of nose, oversensitive eyes, oversensitive ear, cannot bear the noise, cannot bear the daylight, cannot smell, cannot bear the smell of cooking food, cannot bear the perfumes. Okay, these are the manifestations of Psora and can easily find it medicine in antisorics. Okay, now read.
The psoric eye is intolerable tolerant of daylight or sunlight, and the symptoms are aggravated in the morning from the rising of the sun to the gyms and emulated by heat. There are spots over the eyes. This is a characteristic manifestation of this myasm or stigma.
Spots before the eyes. If these spots are coming and going, not persistent, this indicates that this is functional and there is no pathology behind. If these spots are constant, patient is telling I am constantly seeing a dot before my eyes and which is increasing day by day, this is a symptom of retinal damage, retinal detachment, any other retinal disease. Okay, should be taken seriously because it is a pathological condition and Psora alone cannot produce this. This is the manifestation of syphilis and should be looked into anti-syphilitic medicines. Clear? Now go next.
Process of the lead is never psoric but syphilitic. The red leads are a combination of psoric and syphilitic in the tubercular diathesis.
What is, by the way, what is ptosis? What is ptosis?
Tuberculosis.
Ptosis. Ptos. Drooping of eyelid. Drooping of eyelid. Eyelids are drooped and cannot open it. Okay, cannot open it. Have to open it with hand. This is drooping of eyelid. Ptosis. Okay, oculomotor nerve paralysis. So there is a pathology. There is a pathology and Psora alone cannot produce. It is a syphilitic. We have read that syphilitic has a sphere of action. What is a sphere of action? Always remember the last chapter of this Roberts. Okay, we have read that last chapter. I remember that chapter number 31 summary. The syphilitic affections, sphere of affection for syphilis is eyes, meninges, brain, spinal cord, bones, periosteum. Okay, a sphere of affection for psychosis is internal organs, pelvic organs, sexual organs. A sphere of affection for Psora is functional nervous centers. Okay, so always remember these sphere of action. Knowing this sphere of action will lead you to judge that what kind of disease you are dealing with. I have always given example of a child wearing a thick glass and coming to you for treatment. You must be aware that the child has a syphilitic background, a strong syphilitic taint. Children coming with the sixth, this congenital error of sixth finger. Always remember this can be a syphilitic predominant case. Can be always a syphilitic predominant case. Be sure of giving some anti-syphilitic remedy before you start with your totality of symptom. Two things may happen. Totality of symptom may indicate the anti-syphilitic medicine, or even if the totality of symptom, present totality is not giving you some other miasm, but the base is there in syphilis, and you must be that may be hurdling you to go forward. Okay, so remember the sphere of action of these miasm. It will very helpful in your clinical practice. Okay. So red leads are combination of psoric and syphilitic and tubercular diathesis. In the tubercular diathesis, go to ear and we will close for today. Read the ear.
The ear troubles like the eye troubles are functional or nervous. The appearance of the ear is normal. The ear is small or medium in size and never transparent in appearance. There is no moisture in or about the ear as with the other miasm. The auditory canal is dry and scaly. We rarely find an abscess condition in the psoric ear. Since this stigma has such marked nervous reflex, we expect to find the characteristic oversensitiveness to sound.
Underline this. Underline auditory canal is dry and scaly. Air is small or medium in size, never transparent. Transparent air, tubercular. Transparent air. You will see what does transparent air means. Transparent air means it will reflect your torch light. Okay, it will reflect your torch light. That is transparent. Transparent doesn't mean that it will, you can see par this pinna. Okay, transparent air means it will reflect your torch light very clearly. Okay, you will see, you can see the red light flashing from that. That is transparent. Okay, that is found in this tubercular diathesis. So air trouble is also dryness. Dryness is a hallmark of Psora. Everywhere you will find dryness. Dryness in the eye, dryness in the ear, dryness of the skin, dryness of the auditory canal, and oversensitiveness. Oversensitiveness is also a hallmark of Psora. Oversensitiveness of all the senses. Oversensitiveness of mental level and the oversensitiveness at the physical level. Okay, this is indicative of Psora, oversensitiveness. And you will not find the suppurative otitis media in Psora. What are the medicine you will think of suppurated otitis media? You will think of antisyphilitic. Think, close your eyes and think what are the medicines you know, and all the medicines you know about this disease is carrying the antisyphilitic stigma. Okay, leading them all is mercurius. You have seen your teachers prescribing, your neighbor homeopaths are prescribing mercurius for this chronic otitis media. From where this is coming? Mercurius have this type of chronic suppurative otitis media. You will get offensiveness, offensive discharges from here. Okay, think of some antisyphilitic medicine here. And one thing more, you will get in psorinum some syphilitic symptom also. In many medicines you will get mixture of some miasms. Okay, psorinum is the mixture of Psora and syphilis. You will get some antisyphilitic medicines also in indications in psorinum also. So you are getting the air discharge, offensive air discharge in psorinum. Okay, but if it is Psora, if your patient is soaring, they will not be having any discharges from their ear. Rather, the ear dry, the auditory canal will be dry. There may be some itching, there may be some wax, but it will never have those suppurative otitis media. Okay, if it is having this indicates that psychosis or syphilis is there along with Psora. Clear? Oversensitiveness to sound is a hallmark for all the psoric manifestations. Oversensitiveness of all the sensation is a hallmark of psoric manifestation. Okay? Any question you are having? We can answer it in next 5 minutes. Any question? ऐसा कुछ जो नहीं समझ में आया? Okay. Thank you. We will meet tomorrow. We will try and finish this chronic diseases in next 8 to 10 days, and we will move on to our study of organ of medicine. Thank you for giving your attention.
Thank you, sir.